All right, I'm going to do my incentive spirometer and AmbuBag checkoffs in one. First one I'm going to do here is my incentive spirometer that I have here. These are good for post-surgical patients. I also saw two patients today during clinical that had chest tubes put in that had been using these. They actually weren't working as good as they need, so they got changed to an EasyPap, but they did have these in the room if they wanted to get some extra lung exercises, I guess. All right, so for this incentive spirometer, you can use a respirometer to check the patient's IV, IC, and SVC, or if you have this handy dandy chart here, you can figure out what the setting needs to be. This setting here, it goes up and down based off the patient's age and height. So say my patient is 30 years old and a female, and they are 62 inches. So I'm going to want a goal of 2200. So we'll put it about here. And we want the patient to get 33% of their predicted goal is what we're striving for. Obviously, if they hit their goal, that's great. So what they're going to do is just put their mouth around this mouthpiece and take a nice deep breath like this. And as you can see, this went up. Mine wasn't very good, but I did hit that 33% goal. And there's a best, better, and good over here. They want to do this 10 times every hour, as long as they're instructed to have this. They can, I've seen it where they've just done the 10 breaths simultaneously, or they can take a little break, do it again in a couple of minutes, just as long as they get that 10 in every hour. So that's pretty much the incentive spirometer. There is a patient name, patient number, date on the bottom so that they don't get mixed up. Make sure to have the patient sit up when they're doing this, cough when they're done, see if you can get anything to come up. That's about it, that one. All right, so the next one I have AmbuBag. I believe I might have a kid's one, and I don't have a mask that would go around the face. We're gonna just pretend that it's here. So basically this patient's coming in code blue to the ER, and we're at the head of the bed. Respiratories are at the head of the bed here at St. Francis. Got the AmbuBag hooked up here to my O2. And what I will do is, if there was a mask around here, I'm going to put it around the chin. I'm going to keep 2 fingers around the mask and my other 3 fingers around the chin, tilting the head up, making sure that the air is going into the trach and not the esophagus, making sure he gets ample air down to his belly. So I'll turn this on 15 liters. Need a lot of air going through. Get their O2 way up there if we can. Hopefully they make it. All right, so I put my 2 fingers, my 3 down on the chin. I'm going to put the AmbuBag down. Sorry, you can't see very good. Just pretend this is my mask. Make sure this is inflated also. That's how you know the air is properly going through your AmbuBag. I was told here at St. Francis they push on this every 6 seconds, but that would only give you 10 breaths per minute. Here with our labs, they want 12 to 20. So I would just nice, slow, release, count to 3, 1, 2, 3, nice and slow, release. That's the way I'm gonna do it, just to make sure I get those 12 to 20 breaths per minute. Make sure to watch the patient's SpO2, their heart rate on the monitor while you're doing this. You also want to make sure that the patient's abdomen is filling up, kind of watching their belly. That's how you know the air is going down into the right place. Let's see. I think that's about it for the AmbuBag. Hopefully the patient makes it and this gets him through. If there's not anything serious going on. All right. Thank you.